Hello, I'm Michelle, and this is my friend Ron, and he is a former nurse practitioner and was a director of emergency services. And today we are going to be discussing congestive heart failure, the causes, symptoms, treatments, and what medications there are, the prognosis, and the quality of life that there is to be expected. So Ron, what exactly are the causes in the elderly or anybody with congestive heart failure?
Well, it's a two-part process. You have your blood vessels are leaking, and your heart is not pumping efficiently and at the right pressures. So as you age, your body, of course, will repair everything. It replaces all the cells within 7 years. But what happens is it gets tired. So the replacements aren't perfect. They're not exactly original or how they're supposed to be. So they get replaced and they're slightly damaged. So you'll have a lot of leakage, especially if the blood doesn't keep the pressure where it's supposed to be or pump correctly. So you have two types of congestive heart failure. You've got left-sided and right-sided. Mm-hmm. One side will cause the fluid to build up in your lungs.
Okay.
Okay. In a sense that if it's really bad, your patient will drown.
Okay.
And never be any near water.
Okay.
And then on the other side, the fluid backs up in your legs and your extremities because your blood vessels are damaged and the pump doesn't have, your heart is not pumping at a high enough pressure to cause the blood to come back to it. So like a suction pump. A suction pump is going to pull the blood to it and then force it out.
Okay.
Okay, so what's going to happen is it might be forcing it out properly, but it's not pulling at pressure that it needs. Or it's pulling at pressure, but it's not pumping at pressure. So the heart is failing. That's the part, that's the heart failure part of the congestion name. So I always forget this, and it's been a little while. So that's why I'm not going to say right side does this and left side does that. Mainly because I would have to check my books because it's been a few years. So when you have congestive heart failure that involves the lungs, you can hear it. You'll walk into the room, or you can even walk into the house, and you just hear this person rattling, and it's a wet, gurgling type rattle that comes with each breath. And you can hear it. If they're upstairs, you can hear it downstairs. Like
a really bad, pneumonia rattle?
Or worse.
Okay.
It actually sounds like they're gargling water.
Okay.
Okay. So that one, in emergency-wise, you need to get Lasix into them quickly to pull the fluid out of their lungs, because they're in a sense drowning and their Bi-Ox level, their blood oxygen level, is going to be very low. So they're going to be hypoxic, and that means that all the other systems are affected. So it snowballs. Okay, so if you're hypoxic, you're not getting enough blood, and then your pump races to catch up, and then it starts to fail because it is not getting the oxygen needed. Well, when you're drowning, that just makes it go faster. Okay, so when it builds up in your legs, though, the first thing you're going to see is people are going to be complaining about leg pain, or they're unsteady on their feet, and they just can't move like they normally do. And you look down at their feet and you see that their socks are pressed into their flesh, and their flesh is coming over it. That's the edema. That's the swelling. That's all the extra fluid that's in the blood, the plasmas. That's leaking out. It's leaving the blood cells in there because they're too big to leak out. So the extra fluid, the plasma is in the legs. That causes other issues. It causes, since you don't have enough fluid, the blood cells will stick to each other, and of course that's called clots. So the chances of you throwing a clot or having a stroke or a blockage is a lot greater because the fluid that the blood cells will move in is just not there.
Yeah.
Okay. So then you get into the worst forms of edema, which is the normal with congestive heart failure, is the pitting edema. That's where you push into the swelling and the impression stays. The longer it stays, the higher level of pitting edema you have. So if you can press your fingers in there and it leaves the imprint in there for about 3 seconds, that's stage 3. That's the highest level you can get. This person is in danger of having a stroke, having blood clots. They're not so much going to drown, but once again, the blood's not acting normal in the vessels because there's not enough volume around the cells. This is where they're going to throw a clot and the heart's going to stop because it's blocking the arteries and the vessels in the heart, because blood is very sticky.
Yeah.
Okay. Treatment-wise with that, once again, you need to get the extra fluid out. It seems counterintuitive when you have pitting edema to get that extra fluid out when you're already worried about the blood becoming sticky or becoming thicker and that. But what you need to do is when you're releasing the fluid, you also need to push some fluid. Mainly to get the fluid back in there, because when you first ingest fluid, it's going to go into your blood vessels. But then again, you don't want, without releasing the fluid with Lasix or something, or a diuretic, you're going to cause a fluid overload. So don't push the fluids until you actually get the Lasix in there. You're going to push the fluids, which is going to cause the kidneys to work harder and faster and get rid of all that fluid. And you're going to, by pushing the fluid to keep the Lasix working, is going to normalize your blood volume.
Okay.
Okay. And that's the thing. Most people think, okay, I'm going to take this water pill. I shouldn't drink or do anything. The Lasix not going to work unless you actually drink. Okay. Unless you push the fluids, it's not going to work. It's just going to sit in your system and eventually get out, and it's never going to do its job. The elderly will think, I need to take this pill to get rid of fluid, so I shouldn't drink.
Okay.
And there's actually, you should drink a little more than normal, because the more you drink, the more you're going to go to the bathroom, the more that fluid is going to go into your stomach and into your blood vessels and thin it back out and normalize.
Okay.
Okay. So, but the elderly are going to want to stop drinking, and that becomes an issue, because then the medication's not going to get rid of the fluid. Okay. There are, if it's very mild, just a little swelling that happens, this is where you can do what they now call homeopathic, or what I call natural. So we have a lot of things like tea. Black tea is a diuretic. Right? Unsweetened black tea, more like an English style tea, where you're brewing it. That's a diuretic. So if you have just like mild, your feet swell at night or something like that, having like a glass of tea with your lunch to make you go to the bathroom, that might be all you need for a while. Okay? The quality of life that you asked about when you have congestive heart failure all depends on how well you respond to and how well you follow the directions on taking your medications. You can live a long time and a healthy life when you get it under control. But a lot of problems that you're going to have with elderly patients, especially in nursing homes or care environments, is they don't always remember to take their pills on time. At the same time, they don't always remember that they're supposed to drink. You know, you you take Lasix, which is the most common
Yeah.
prescription drug that you're going to give to someone that has congestive heart failure. It's the first line defense. You know, it's like, oh, your feet are swelling and you're not moving it right. We're going to give you something to remove the water, a water pill. We're going to give you Lasix. So most people take that. And even the younger people, they'll never ask the doctors, well, okay, I'm supposed to take this to remove water, and they don't think that they need to drink. And a pharmacist isn't going to tell them. And with the elderly, they're going to forget that they're supposed to drink. If they, take the pill, and most times if you're in the hospital, you have an IV in, they give you the Lasix. A lot of times they'll give it through your IV, and it's dripping.
Yeah.
So they're already giving you the fluid to normalize your blood, and now they're going to try to get the fluid out. And they forget to tell the patient, hey, you need to drink.
Yeah.
Okay? If you're supposed to, you normally drink a glass of water a day, you take this pill, you're going to drink 2 or 3 glasses of water to make it work. And yes, that means every 15, 20 minutes you're going to be running to the bathroom at first, but it's going to get all that extra fluid off you quick.
Yeah.
And then, you can sip and slow down. People that are supposed to be on Lasix or any type of water pill or any type of diuretic. There are some others out there that are more expensive or they don't work as well, or they work really well in a hospital setting. If they're not going to be compliant and actually do the things, the outcome's not that great, because once again, you're talking about in 90% of the cases of congestive heart failure, you've got the edema in lower extremity. Okay, remember what I said, the blood becomes thicker.
Yeah.
Blood is sticky. The red blood cells are going to want to stick. It's going to go in a clot.
Yeah.
And you're going to throw clots, and you're going to have strokes. You're going to have heart attacks
Yeah.
that are all clot-based. So damage is going to be done, and damage is going to be exacerbated from previous damage, and the outcomes become very grim. Okay. And with the, I'm pretty sure it's right-sided, but the other congestive heart failure where the fluid's backing up in the lungs, that's just as dangerous because, once again, it's drowning.
Yeah.
Okay, so one, you became anxious, you become fearful, and your fight and fright instincts will, it's fight or flight, but it's actually fight and fright to the patient. They're frightened, and they're going to, the fear level is just going to go off the roof, and you're going to have more problems.
Yeah.
More fearful, the more frightened they are, the more oxygen that their body thinks they require, and they're not getting the oxygen, so it just spirals way out of control. That type of congestive heart failure, that's grimmer. That's going to kill you faster, or your patient's going to have a very poor outlook. And maybe only have a couple of years. I believe it's left-sided, is what my brain is telling me. With the edema backing up, you can live a long time with that as long as you're compliant with your medications and do the exercise. And the exercise mainly is walking. The more you walk, the more your muscles develop and help pump and push the blood out. Okay. See, a lot of elderly people lose muscle tone and they lose musculature. So, the compression that's normally there in a younger person is just not there.
Yeah.
Okay. So the blood doesn't want to go up, and it's not being pushed up, and it's not constricted to go up. So why should it?
Yeah.
Gravity's working against you here. So in younger people, they're active. Okay?
Yeah.
So if you think about it, as they're walking, it's actually a secondary pump.
Okay.
It's a secondary, in a sense, a secondary heart, because with good muscles in your legs and that,
Yeah.
as you're walking and moving, you got a pump going this way, you got a pump pulling this way, and it helps. Now, when you're elderly, your pump moving this way, your muscles are gone.
Yeah.
And your blood vessels have been damaged through time. You know, the cloning aspect of it.
Yeah.
You know, replacing the cells. They don't replace exactly the way you're supposed to, and they're slightly damaged. And each generation of cells is being replaced, and they're not as good as the previous set. So no muscles to help pump up. Blood vessels are leaky now. So, and gravity is going to let the fluid just stay down there. Pumps your main pump, your heart is tired. It's worked for, you know, say 60 some years, and the pool's just not there.
Yeah.
Okay, so that's a good recipe of having congestive heart failure.
Yeah.
And the elderly, they have the other health problems that cause them to not want to move too.
Yeah.
So, can you have a good life? Yeah. But once again, you got to get into a routine of taking your medicines on time and following properly of giving the medicine some help of extra fluid, drinking it, not so much through IVs, and walking. Walking is a big one because you're going to keep or rebuild. If you're 70 and you're able to walk, you're going to keep enough muscles down there to have that secondary pump in your legs help push it back up.
Okay.
Okay. But most of the people that are in care environments, they don't walk anymore. They don't move very much. They lie around or they sit, and your secondary pumping system just falls apart. So if you can keep that from happening, and you can keep your muscles in tone to some extent, and even with congestive heart failure, you can live in your 90s and still be active. And if you look around at all the elderly people or older people that are in their 80s and 90s and very active, they might have had stents put in, they might have had heart attacks, but they're active.
Yeah.
They don't have the health issues that you do when you're inactive and you lose that thing. You know, you lose your secondary pumps system of your muscles helping pump and constrict. You know, the compressions. You don't lose that, and that keeps them healthier, and it's a cycle.
Yeah.
Keep your body healthy even into old age and moving. It wants to stay that way, even if it needs some help with medications. You lose that, even though you take medications. It's going to be harder. It's not going to be as effective. And you're going to slowly wind down and spiral down.
Yeah.
So that's it. It's not necessarily an elderly disease or an old folks disease, because we have people now that in their teenage years that are having heart damage through environment and genetics, so you start to see a lot more congestive heart failure in kids. And that, 20 years ago, it was unheard of.
Yeah.
Now it's uncommon, but you immediately think, oh, it's never happened before. It's like, oh, I haven't seen this in a couple months.
Yeah.
Or, it's been a while, or you're in a big city, in a big level 1 trauma center, it's like, oh, well, I see this every day. And before, 20 years ago, you wouldn't have. In a level 1 trauma center, you might see it once a month.
Yeah.
But it is manageable. The biggest thing besides medication that really helps is the walking.
Getting them up and walking, or maybe having them ride a stationary bike.
Well, okay, balance is going to be off.
But
I
like
would- I
those
wouldn't-
stationary bikes that they set on.
Yeah, I wouldn't do that with the elderly. If you're in a care environment to begin with, you're already
Yeah.
unsteady and don't have balance. But just walking in a care environment, walking in the halls,
Yeah.
pacing your bedroom, you know, getting up and going to the bathroom. So LASIK is going to make you want to do it.
Yeah.
You know, instead of taking a ride in the wheelchair, walk your wheelchair there. And when you get you're too unsteady on your feet, then it's time to sit down and finish your way there on the wheelchair. But then don't just come back. You know, try to build yourself up to where you're doing it with the wheelchair at first, and then a walker, and then a cane. I mean, you can build yourself back up.
Yeah.
But getting the muscles moving to get the blood pumped back up to get some relief on the heart is the best thing you can do when you're elderly.
Yeah.
That kind of answer your questions?
Yeah, that does. Thank you so much.
Okay.